Welcome to Florida Surgical Weight Loss Centers. You probably received an email invitation to be here, and we are happy you are taking your first step. So, let's get started with learning about obesity versus weight loss. In the next slide, as you listen to the doctor, understand that obesity is a disease, know what body mass index is, and know your BMI. Understand the relevance of the two. Meet one of our doctors, who will now take you through some very important information.
Now, let's start with the basics of what is obese and what is overweight. And it's a distinction. It's an important distinction. Louder? Oh, okay. Sorry. There's an important distinction. Overweight just means that you're over the weight that you're supposed to be at, but you don't necessarily have medical issues associated with it. But once you start hitting obesity, you start getting medical issues, joint pains, incapacity, issues that are affecting your body. So overweight refers to having more body fat than what is healthy, and obese refers to excess body fat accumulation leading to adverse effects on your health. Why is that important? It's because a lot of us may sit there and say, well, I'm just overweight. No, you're not. You're obese. Because if you have a certain amount of weight and it's affecting your daily life, you're obese. Right? And fat is a derogatory term, in my opinion, that should not be used. But don't be afraid to understand the concept of obesity. Say, yes, I am obese. There's nothing wrong with that. You need to, in order to fix a problem, you have to recognize it, right? So it's okay to say, yes, I'm obese, but guess what? If you do this right, eventually you're going to be overweight, and eventually you're going to be normal weight. How cool is that? Right? Go ahead.
Notice, as the doctor pointed out, your BMI is directly related to your health, and as your BMI increases, so do your chances of getting sick. These are common goals for men and women regarding BMI. As you can see here, obesity is related to several challenging diseases. It's also very expensive for you. When you are obese, take a look at how much extra money that most of us don't have is spent when someone is obese. Women can spend up to an extra $5,000 a year if obese. Let's now listen to the doctor talk about exercise, your diet, and the path to a healthier lifestyle.
Don't feel guilty looking at it and saying, I want to look better. That's important too. That's such an important thing for your self-esteem and your psyche. So yeah, both things are good. You want to look good and you want to feel better. Okay? They're both important. There are tons of diseases associated with obesity. Gastroesophageal reflux, stress urinary incontinence, diabetes type 2, very important. Hypertension and fatty liver disease. But a lot of you know about sleep apnea. Asthma is associated with obesity. And also, many cancers are now being associated with obesity. So much so that the American Cancer Society is taking tremendous notice on the importance of nutrition and health. Okay? Next. So what are some of the strategies for losing weight? Well, diet and exercise, of course, are very, very important. There's nothing wrong, even with a band, to help yourself. Like some people do Weight Watchers with a band. There's nothing wrong with that because some people need that structure. So some type of structure always helps. There's nothing wrong with that. But that alone doesn't usually do the trick. Exercise is extremely important, but so many people think that exercise, and I'm sorry, P90X, that's a great program, and I've tried it myself. But the truth of the matter is, if you exercise for 30 minutes, and you really hit it hard, and you sweat, and you suffer, you might burn 400, 500 calories, but if you're eating 4,000 calories, that's a drop in the bucket, right? That's why people can exercise and realize that they're not losing anything. Because exercise alone won't do it either. Okay? And it's a great thing. Exercise is wonderful because if you exercise, you help maintain that weight loss. So I'm not saying don't exercise. It's wonderful. But exercise is not going to take the weight off. Right? The other thing about exercise, I usually want my patients to start doing it after they've lost 10 to 15% of their weight. So when you first come to me, I don't want you hitting the gym. I don't want you going crazy because you're so heavy. You're out of breath. You're tired. You're fatigued all the time. It's really difficult to do that. And guess what? If you do it then, and we force you to do it, chances are you're going to quit, right? You say, this is really tough. But if you lose as little as 10 to 15% of your body weight, all of a sudden you have all this energy, the stress on your joints is less, you're able to do things you never thought you could do. And the world changes for you, and you're more likely to keep it, to stay on that program. And I found that to be very helpful with my patients.
Let's have a look at some different treatment options. What about drug therapy?
The worst thing about drugs for weight loss is that they are so easy to get on them and say, man, this is great, and depend on it. And it does this job, and I don't have to do anything. So that's doing this thing here, and I'm not doing anything over here. And as soon as you stop it, you gain all the weight back. Guess what? Remember that cycle of obesity I talked to you about? If that happens and you fail, what happens to your guilt in that cycle? Right? And then what happens to the anxiety? Depression? Overeating. So every time you fail a diet, that cycle gets worse. All right. So let's talk about surgery, right? Now,
In our next video, we will begin to talk about the procedures and options of weight loss surgery. Thank you for your time, and please stay tuned right after for the next video on weight loss surgeries.